Why does BPH cause urinary hesitancy? Benign prostatic hyperplasia, or BPH, is a common condition that affects many men as they age. One of the frustrating symptoms of BPH is urinary hesitancy, which is the difficulty in starting urination. This happens mainly because the enlarged prostate gland compresses the urethra, the tube that carries urine from the bladder out of the body. When the prostate enlarges, it can create a blockage that increases resistance to urine flow. This makes it hard to begin urination and can lead to a slow or interrupted stream. There are two main reasons why BPH causes urinary hesitancy. The first is static obstruction. This occurs when the physical enlargement of the prostate tissue compresses the urethra. As the prostate grows, it narrows the urethra, making it harder for urine to pass through. This compression distorts the bladder outlet, which means more effort is needed to start and keep the urine flowing. As a result, men often experience hesitancy and a weak stream. The second reason is dynamic obstruction. This involves the increased tone of smooth muscles in the prostate and bladder neck. The prostate contains smooth muscle fibers that can tighten, especially when stimulated by the sympathetic nervous system. This tightening further restricts urine flow. This dynamic aspect can change, which is why some medications, like alpha blockers, are used to help relax these muscles and improve urine flow. Additionally, if the median lobe of the prostate enlarges, it can intrude into the bladder outlet. This can create a ball valve effect, where urine flow is intermittently blocked during urination. This can worsen hesitancy and lead to feelings of incomplete bladder emptying. Because of these combined factors, men with BPH often struggle to start urination, experience a weak or interrupted stream, and feel like they cannot fully empty their bladder. If the obstruction becomes severe, it may lead to urinary retention, which is when the bladder cannot empty completely. It is important to note that while BPH is a benign condition, it can elevate prostate-specific antigen levels. However, it is not a risk factor for prostate cancer. Symptoms like urinary hesitancy should be evaluated by a healthcare professional to rule out other possible causes, including malignancy. In summary, urinary hesitancy in BPH is primarily due to the enlarged prostate compressing the urethra and increased smooth muscle tone, constricting the urinary passage. This obstruction makes it challenging to start and maintain urination, highlighting the need for effective treatment options that can either reduce prostate size or relax the muscles to relieving symptoms. Always consult with a healthcare professional for personalized advice and treatment options.